So when patients dislocate their jaws, we know that we've got a ball and a socket that's moving like this, and the thing that people don't realize is there's a hump that our jaw kind of slides down. So when you're jutting your jaw like you're a bulldog, you kind of can feel it go underneath that kind of little that little bulge there, that articular eminence. The interesting thing is that when somebody's dislocated, you can't just push it back or close it in. You actually have to get underneath that hump again. And so you're going to want to actually go ahead, and sometimes people talk about pushing down, or having the jaw push down and back, not just back. An interesting thing that I was taught is that you can actually hitch it up a little bit better using the ligaments. And this is also really helpful for if you need to do like physical therapy or physiotherapy type exercises to kind of stretch out that jaw joint. People who feel like their bite's off a little bit because that little meniscus between the ball and socket there is out of place, a disc displacement. So the trick to this is that, and again works not just for jaw joint muscle strain kind of stuff, but also for dislocations, is that you're going to go ahead and fish hook yourself. Let's say we're working on our right jaw joint over here. You're going to fish hook yourself, and you're going to pull towards the wall in front of you. Okay, and then with the other hand, of course with washed hands, you're going to go ahead and stick it as far back as you can, even behind your back too, kind of on that retromolar pad there, and then go ahead and push down into the ground there. So you're going to be pulling forward, your bottom jaw, your mandible forward with one hand, and then with the other one you're pushing down. So you're almost going to, if you can take the, your jaw joint and think of it like some goal posts here, you're almost going to be trying to pull it forward and pull that angle here, kind of stretch out that muscle there that attaches in. That's that lateral pterygoid there, so you're going to want to stretch it out this way there. And the lateral pterygoid is also attached to that disc or meniscus between the two, between the ball and socket. And so by doing that, you can almost hitch it back up into a position where that disc may recapture and not be displaced anymore. Okay, so forward towards the wall, and then down here, and then nice, good stretch. Think about it if you're going to stretch your hamstring or your quad, and that same kind of feeling you're going for there. On the opposite side, if it's your left jaw joint, you're going to fish hook with your right hand there. You're going to pull out this way, and then with your left hand, all again on that retromolar area behind your back tooth there, even on the gums. If you want to go on your tooth, that's fine too. Forward, and then down into the ground, and give it a nice good stretch. As with any physical therapy type exercises, you can tell somebody to do it 10 times a day, and they're maybe going to do it 2 or 3 times a day. But the goal for me, an ideal goal would be, hey, if you're going to wake up in the morning and you feel like, hey, the jaw joint's a little bit weird, or you're not biting right, or you've got a kink in your jaw joint there, then go ahead and do it in the morning when you wake up. A lot of times that can be also caused by night grinding, other unconscious stressors and things like that. I think, again, at the end of the day, before you go to bed is a good idea, and I think a good idea is just to time it around meals, maybe before or after. I think holding the stretches for 30 seconds to a minute is an ideal time if you can do that. Kind of let things kind of settle down after that. So I aim for 5 times a day, or at least that's what I tell patients to do. And we get pretty good improvement from things just as simple as stretching your jaw joint out. Thanks.